When we're talking about teenage pregnancies here, I told you earlier on that I have mind-boggling statistics. 2,379 children between age 10 to 14 were impregnated last year. It is a slight decrease from 2019, but still mind-boggling. New data released today, covering months between January and October this year, has shown that 1 out of 8 adolescent girls are either pregnant or have given birth, sounding the alarm over the rising numbers of teenage pregnancies. The statistic released by the National Council for Population and Development and the National AIDS Control Council, rating Kenya's capital Nairobi with the highest pregnancy rates. However, the figures only factored teenage girls who have sought medical assistance, raising concern over the number of teenage mothers across the country who have not sought medical assistance. Chemutai Goin has more details.
Teenage pregnancy.
As the country prepares to mark the World AIDS Day on December 1st, new challenges impeding the fight against the incurable disease are emerging. Teenage and adolescent pregnancies forming part of the bottlenecks frustrating Kenya's efforts to reduce new HIV infections by 75%.
We start every year having 6,000 new infections among children, and then we start having children also getting infected through sex. So it means as a country, the dream of ending AIDS in Kenya will never become a reality. The only way to become a reality is we have to end AIDS and HIV infections among young people and adolescents and children.
The survey conducted on girls aged between 10 and 19 years, showing worrying figures of child mothers and teenage pregnancies.
Averagely, teenage pregnancy and motherhood is estimated around 18%, according to DHS. That means 1 in 5 teenage girls are either pregnant or a child or is pregnant.
Leading the pack is Nairobi County with 2,379 teenage pregnancies, followed by Homa Bay with 1,530, Kajiado with 1,496, Mandera with 1,370, and Bomet recording 1,041. 9 counties accounted for 56% of the total teenage pregnancies at 20,803. These among children aged between 10 and 14. They are Nairobi, Kajiado, Homa Bay, Meru, Kericho, Narok, Kisii and Mandera. But for some counties, interventions had been successful. Trans Nzoia cutting down the percentage of teenage pregnancies from 41.1% in 2020 to 27.4% this year. Tharaka Nithi with 32.8% in 2020, now registering 24.2%, while Lamu dropped to 15.4% from 22.3%.
If you look at our figures on maternal mortality, ratio is twice as high in women age 15 to 19 years compared to those aged to 20 to 30 years old. Teenage pregnancy-related complications are also leading causes of maternal mortality in the women of reproductive age.
The National AIDS Control Council and the National Council for Population Development noted that while the drivers were different in every county, common factors aggravating the situation included sexual violence, inadequate information on reproductive health and services, forced marriage, poverty, lack of parental guidance and peer pressure.
So we may need to get these terminologies that make all of us shy away from discussing these matters of sex.
The stakeholders further alarmed by the rising rate of infection of HIV amongst children and young adults that is contracted sexually. Between January this year and October, so far, children and adolescents between 10 and 19 years accounted for 5,294 new HIV cases. AIDS-related deaths in 2021 recorded from the adolescents between 10 and 19 years being 1,473. The stakeholders further imploring parents to have an open conversation with their children on matters sexual health so as to ensure girls remain girls and not mothers. Chemutai Goin, Citizen TV, Nairobi.